Good morning, everyone. I will take you through another type of shock, which is the earthquake in Turkey. And I will be focusing more on the health workforce management and planning. So, as a background, Turkey is known as an earthquake-prone area, and it ranks third in the world in terms of the earthquake-related causalities. At least there is one 5-magnitude earthquake per year in the country, and the 1999 Marmara earthquake was a turning point in terms of the disaster management in the country, and it highlighted the need to establish a single government organization that should handle the emergency response. Of course, you all know that on the 6th of February 2023, Turkey was hit by two earthquakes in the southeast Turkey and northwest Syria. The statistics, you can see here how the death toll was above 50,000. More than 100 have been injured, and 2 million people were displaced. And I should tell you that 11 provinces in the country was almost destroyed in different levels, but the crisis was really severe. Among all these statistics, 448 healthcare professionals died, including 102 physicians, 58 nurses died as well. So our study, we aim to generate evidence to help strengthen the local health system preparedness and emergency response to shocks by improving the health workforce management in Turkey. We conducted a qualitative exploratory study in 2 districts in one province of the most affected provinces by the earthquake. We collected data through document review, 30 key informant interviews, and 4 focus group discussions. The findings showed that there is a strong disaster and emergency response mechanisms in Turkey, and it's all led by the Disaster and Emergency Management Authority, which they called AFAD. AFAD led the overall emergency response during the earthquake, and they already have a very well-established national disaster response plan. The Ministry of Health led the health response, and the Turkish Red Crescent led the national response in terms of nutrition, mass feeding, and blood donation. International organizations and NGOs played an important role during this crisis, but it was mainly for the northwest Syria. So many are based in Gaziantep in Turkey, but they are to serve the northwest Syria or to work on northwest Syria. Many organizations mentioned that they cannot interfere with the health response in Turkey, only for mental health and a little bit of physiotherapy. So in terms of health workforce management strategies, they learned well from previous emergencies, and they tried to adapt the strategies that have been used before. So from the Marmara earthquake, they worked to improve the training and coordination. Also, they learned from COVID-19 pandemic in how to respond more effectively to any crisis. And in terms of that, they used remote management mechanisms. They were very flexible in terms of attendance of staff, and they also worked rapidly to adjust the existing policies to be able to successfully respond to the crisis. So for mobilization and recruitment, there is National Medical Response Team, and the emergency plan in Turkey depends on the the link between provinces. So if province A in the plan knows that if there is a crisis in province B, National Medical Response Team will move from A to B. And so on for all the provinces. There are 81 provinces in Turkey, and they all link it together in the plan and know where to move. But unfortunately, during the earthquake, there were 11 provinces around each other. It was in one place. So there was like a gap in the how they mobilized the teams from other provinces to the 11 affected provinces. Also inside the affected area, there was a mobilization or deployment of medical staff among health facilities to overcome or manage the workload in each facility according to the severity of the crisis in each province, or how the workload in each health facility. As I said, organizations adapted existing policies, so they reduced, for example, the recruitment process from 8 stages to 3, and they also employed flexibility in terms of attendance. In terms of task shifting and role adaptation, same, medical professionals adapted to increased demands, so they worked for extra hours. Non-medical staff jumped in to help with psychosocial support and the mental health services, and so on. Volunteer mobilizations and management, that was really integral part of the emergency response during the earthquake, because over 600,000 health workers from across all Turkey moved to the 11 affected provinces to help or support the emergency response. Turkish Red Crescent alone mobilized like 75,000 health workers, volunteer health workers to the affected area. Also, I should have added here that also the WHO managed the greatest mobilization of health workers in terms of the external medical or internal medical response teams. In terms of health workforce support, health workers were personally affected by the earthquake. So the first step was to ensure the safety of them and their families, so they will be able to be involved in the emergency response. And also organizations implemented the staff support mechanism. They provided cash grants and financial compensation, temporary housing for those who lost their houses. Also, as explained before, they modified the work structures, and importantly, they provided mental health support through debriefing sessions, online mental health and peer support groups. This is my final slide, and it's about the gaps. Although all participants appraised the response of the government and how they contained the emergency or the crisis, however, the crisis was really severe. It was beyond the capacity of the government. So this crisis highlighted some gaps, and one of them was the initial coordination and communication, especially in the first 72 hours, because of the high influx of volunteers from everywhere in Turkey, the internal and external medical response teams. So there is really a need for a rapid response coordination center, and maybe using a digital tracking systems to be able to coordinate all these health workers. Also, although there is health workforce training on disaster preparedness and response, but also that was inconsistent before the crisis. So that has been highlighted during the crisis, the need for more solid training mechanism, and to include the volunteers in the training, disaster response training, and may also incorporate disaster preparedness training in medical education. Again, there was mental health and psychosocial support, but it was inadequate, especially with the high intensity of the crisis and how health workers themselves have been hit by the crisis. So integrate mental health services into disaster response protocols is essential, and also maybe regular mental health check-ins to reduce the burnout of health workers. Last, limited coordination with international organizations and NGOs. As I said, they do not allow international organizations to be part of the health response in the country, but with the massive intensity of the crisis, there should be kind of a structured partnership protocols to leverage these external expertise and resources without compromising the national leadership inside the country. Thank you.